Yay. Hi, Stephen.
Hi, Nand.
Hi, Doriandra. Yay. It's nice to see people.
Even though they're digital facsimiles.
It's fine. It's fine. I'm not picky. Um, Day has been long. Tuesday, Wednesdays, yeah, work. Yeah. Public health is busy.
Any
So,
any more of the dreaded pox arrived?
I'm sorry, say it again. The
Any
dread.
more of the dreaded pox?
Oh yeah, we got a couple of more. We got two more in Lane County. We do.
Yeah.
So it's not gone. Doesn't seem to be sprouting the way it was previously, but it's not gone. The bigger issue right now is flu. It's about 3 times more prevalent now than it was this time last year.
Whoa.
300% higher.
Whoa. Is that because people have not been wearing masks for
We don't
recently?
know. We don't. We
Or
don't know. We don't know for sure. That's may well be a contributing factor. There are a lot of things that are, but it's a big deal. There are several schools where about half the students aren't even there anymore.
whoa.
What's going on as far as is it
Flu.
flu or
Yep,
yeah.
flu. Yeah, people discount it, but it's a big deal.
Yeah.
The smaller the person, the bigger the deal it is, because they have smaller lung capacity. So any respiratory stuff hits smaller people harder.
Yeah. Is the RSV thing really big right now too?
Yeah, that's also big.
Yeah.
That's also big. The combination's bad.
Yeah.
So that's the thing.
I imagine too, parents of young kids, if their kids are sick, they're afraid of RSV. So probably hospitals are full of, or urgent cares are full of parents bringing kids in just to make sure
Yeah,
it's not
that's a
that.
big deal.
Yeah.
Another thing that makes us run out of beds. I'm not sure exactly where we are with that in Lane County at the moment, but nationally it's a big deal. So yeah, that's a fun thing.
I do know that in Lane County the beds are starting to fill up because I have a
Yeah.
couple of nurses who are friends of mine. Yeah.
Right. I'm not surprised. I just don't know what the specifics as to why that is just yet. There are a variety of factors.
People
COVID's
stopped washing their hands.
that certainly doesn't help any, that's for
Yeah.
sure.
Yeah.
The stopping washing hands, the pretending COVID's over.
Yeah.
Or never happened.
I
Pretending,
can say that I'm starting to see more people wearing their masks. So that's
yeah.
actually, and then at our job I've been talking to the team about, hey, let's not stop disinfecting things. We're still kind of doing the same routine.
It is
Yeah.
interesting. It's interesting. The first batch of COVID turned out it wasn't really all that easy to transmit off of things. We call it fomites in the business. But the more updated versions, yeah, they're big time on fomites, which
Yeah.
is weird because at first everybody was bleaching their food, which was stupid. But nowadays, actually, yeah, trying to clean not the food. Don't clean the food. Don't not clean the food, but I mean, don't Lysol the food, right? But yeah, it has actually gotten to be a thing where before it wasn't a big deal, but now it is. So who knew? Mutations will go wherever they can. So that's how that works. So yeah, good news from the public health sector. Sorry about that.
I had
Still,
a quick little thing
sure,
when we're
please.
ready.
Yeah.
So this is kind of for Doriandra, and we lost and missed an opportunity, but we were asked to do the vaccine clinics again, which we all
Yeah.
know, we didn't have the time.
Right.
Unfortunately, like fortunately, because maybe we could do something later. But Drea, she's working for another nonprofits that are doctors and nurses who are mobile, and they're working with the houseless.
Good.
And we were going to, I was discussing with her of them actually doing the whole entire vaccine clinic, doing the program managing for it, and they were ready to rock and roll for us. but unfortunately the date passed. I handed off to 2 board members and it just kept getting, so I reached out to Kendry today and I was like, is it too late? And she said, yeah, it's too late.
Yeah.
But, you know, if we have an opportunity, we definitely have mobile doctors. And I asked Kendry to please notify us because we have a couple of places that, you know, we could kind of maneuver.
Right.
And then something that was quite surprising, but not surprising, that I found out yesterday. One of the things that's happening with housing and why the market has been so, you know, like not so much is because people are looking for passive income. Basically, they've been turning their places into Airbnbs.
Right.
And
That's a
these
big deal.
Airbnbs have been basically taking up our neighborhood alone. I looked it up. We have 158 Airbnbs just in this
Holy
neighborhood
crap.
alone. Okay. And one of the good things for the rental market, what's going to end up happening is, because right now the Airbnbs have seen a huge decline on reservations. And it's because of, it's kind of a twofold thing. They're asking people that when they go to the Airbnbs to clean up after themselves, take out the garbage, basically all these things that you would do at your own house,
Right.
and then charging them a huge cleaning fee on top of that.
Oh,
So
wow.
people are kind of going back to the hotel styles of things,
Mhm.
and Airbnbs are going down. For the rich or those who were just trying to make passive income, not such a big deal. But for those who actually bought houses and expecting to do that, now they're seeing those short-term rentals are completely empty. So to me, this is a great opportunity for like housing to say, hey, if we give you so much money, maybe you could bring somebody into this house. I think it's going to open up the rental market a lot. I feel bad for people who don't understand what the word investment means, which means you have to put your own money in it. And they've got these huge mortgages on these Airbnbs that they're just not going to be able to pay. So even though I feel bad for them, I don't, because I think that this is also a good opportunity for like the, you know, long-term rental market too.
Mhm.
So that was just something that I kind of was pondering yesterday.
Can I ask where you've got that information? Perhaps it would be useful for us all to know how to find those places in case we want to deal with them directly.
Well, basically what I did yesterday was I just Googled Airbnbs in the Whitaker, and
Oh,
158 of them came up.
wow.
Wow.
But
That
I
easy.
think
That's great.
yeah, that easy. So basically what I'm gonna do is kind of like hone it in a little bit more and see where we
Sure.
can get that, you know,
Sure.
just
Thank
in
you.
a listing.
Yeah,
Yeah.
that's great.
And
You,
then
you know,
I can tell you on my block alone, I
mhm.
had 3 Airbnbs. One of them sold the house, and thank God, you know, it's a young couple who already purchased it. But I have an Airbnb in front of me. I've got one to the corner,
Oh my
and
gosh.
yeah, it's insane. Actually, 2 on the corner, not just one. So there's still 3 of them.
That
That's
is Starbucks.
Yeah.
that's so neat, Delinia, because if if folks would agree to do that, then that's where we can come in and say, hey, we're going to incentivize you with, I don't know,
Right.
you know, extra money to just like do this and close the loop. So that's really cool.
That's great.
And not pay the Airbnb prices, of course. Like,
Well,
not,
no, I think what
yeah.
what I understood you
But
saying was
yeah,
connect to the person and just say, look, we have a housing crisis in Eugene. Whitaker Community Council is working to incentivize, you know, landlords to do the right thing and get actually a person in there on a full-time status. And, you know, maybe that's something we could add into our program. If you find those folks that, I don't know, we could give them an extra security month deposit that they can keep, or I don't know, something rather than them not making money, and then, our neighbors and friends not being able to get into a rental. So
See if they'd be interested in a long-term lease, because, if we could put that money up front, at least they'd know they were going to get that.
yeah.
Just,
Yeah.
it might be
I
other
wanted to get a little bit more statistics because
Sure.
this was more nationwide that it was happening.
Yes.
Right.
But like I said, just investigating our neighborhood alone, I was like completely shocked. I mean, I knew there were some, but I had no idea
Yeah,
that there
that
was
is,
that many.
yeah, considering where we live, that is surprising.
Yeah.
Okay. I think it's probably as many people as we're going to actually get here, so we might as well get started with things. I've got two major things that I would really like us to get informed and talk about. The first one, of course, is what Doriandra's working on, and the other one is what was talked about at the general meeting, the Clean Air Oregon stuff. I think that's really important because I was bringing up the possibility of and it looks like they're looking into it, rating air pollution based on the actual health effects instead of just numbers, right? And it looks like they're kind of moving towards that. And how can we, as a neighborhood and as a community, use that, right? So I want to bring that up a little bit later. But Doriandra, if you are feeling up to it, it'd be nice to have a report as to what's going on.
Sure. Yeah, I'm really happy to share that with you guys. Let's see. Yeah, there's so much. It's a big
Yeah,
cloud.
I know.
So, let's
Okay.
let's see. I think let me break it into some categories because that's
Sure.
kind of helpful. What is done and then what is pending, kind of, that would be good. So, in terms of good partnerships, and plans of partnerships, agreements towards that, Laurel Hill thus far is kind of my strongest working partner thus far.
Right.
And working with their executive person and their housing person. And so what I've done is create a spreadsheet that I'm working from. And when Andrea over at Laurel Hill gets a person that is a candidate, and they have done the initial front door assessment, because we don't have that capacity to store. We don't have HIPAA stuff. We don't have any of that. Then they say to me, Doriandra, here we go. And they give me all of their information in the spreadsheet. So then from there, so we have two clients now that I'm working with that we're trying to get help to. One is a DV case, domestic violence case, and then the other is a person that needs assistance because they're going in for a massive surgery and they know they cannot work for several months. And so yeah, I'm starting to do that programming with that. And it's been bumpy because we've learned some stuff, when folks are in crisis, it's kind of hard to get a real communication back and forth, but it's pretty good thus far. And then I'll show you all what they get once I make initial contact with them and Laurel Hill hands them to me. Then they get this from us. This is let me share this if I can. This is the intake form that I built that folks can connect to. Let's see if that's in the chat for you. That'll take us over. Hopefully does that open up for you guys?
Yeah.
Okay, perfect. So it's kind of a quick little assessment. It asks them, are you in the house in the Whitaker or no, but you want to live there? And I think that holds space for folks that are unhoused or just trying to be part of the community. And then it asks them the certain, to quantify the different services that they need that we're qualified to do. And then it tells me straight out of the gate whether they're linked to any of our partners. And some of these partnerships are not completely, firmed up, but at least I know where they're coming from. And then I've got a chance to actually verify, that they are within the Whitaker. And then household, it looks like that's a double one, and then it talks about what else, we need to know. So from there, then I have the verification finally from the state of Oregon, the ORAP here's some of their documents that are legally correct for us to be using. So these then are the secondary kind of aspect that I'll do with them. This is kind of their, oh, I think I sent the same one twice. No, okay. Yeah, there's 3 of them here. One is a basically self-verification that manages income eligibility. And then the other one's talking about relationships between the tenant and the landlord. So all of these 3 are differing as to, what the person's particular incident is about. So that's kind of our front facing intake. Oh, go ahead, Delinia.
Just a quick note about the Google Docs. Because I see there's a spot for email and then a spot for contact phone number.
Mhm.
Would it be wiser to kind of keep those, like, what is the preference for contact? Do you know what I mean? Because some people are not going to have email and some people, and the one thing is my pet peeve is when a document is asking me for something that I don't have, and there's no way of actually saying, that I don't have that.
Totally. Great
Yeah.
point. And yeah, we want to be absolutely equitable in recognizing that there are a lot of barriers like that for some people. And so that's why primarily, like I've been using phone call primarily to talk to folks first, and then assess if they can, then I need them to do that form. If not, then it's all going to be by phone and maybe meeting them in person to do intake. If it's me driving down and putting the ORAP legal forms in their hands, if we do it that way. So yeah, thank you. It's a huge point. And essentially we're assuming that they have email because if that's convenient for them and better, then, and then the form itself gathers email addresses. So I'm hoping that we're just going to rely on all 3, whether it's, in person, phone, or that, but thank you for that point. Okay, so let's see. So moving from there,
Can I ask a question about the form?
yeah,
What type of services do you need assistance with? We've come across a couple of instances where people are living in a trailer, and they obviously can't be on the street for more than 3 days because the city tells them to move. And we have somebody that we keep finding people's driveways for him to be in, and he always has problems finding a place to park it, and wondered whether that's a category that we can cover, or is that too migratory?
legally, the things that are in that selection base are
Yeah.
things that are grant compliant specific.
Okay.
So that's why I put at the bottom, like, is there anything else you need us to know? Because that's when someone could say, hey, none of these apply to me.
Yeah.
And I just need a driveway. So, but it's an excellent point, and I'm going to talk about the next partnership thing, which really is an answer to folks that are in that state of crisis, because
Okay.
I have a solution for that too, because it's so different than this. I think
Yeah.
this is like what we're looking at with the form, and is really like people that are already in houses,
Yeah.
that are in crisis. And so, but yeah, one of the other partnerships that was, that's been kind of taking the longest time, but I think is the most valuable, is those folks that you're talking about. And so I realized that the best way to access them is through a new partnership with Brenda. I can't remember how to say her last name. It's very complex, but she's the program coordinator over at the Eugene Community Court.
Yeah.
And does everybody know what the community court does?
No.
Okay, it's really our base fundamental for folks that are experiencing unhoused crisis, because the community court is for folks with really low crimes that are based on being homeless, and it's like they're misdemeanors that people, lower level offenses that folks get for, I don't know, like falling asleep at the LTD bus stop because they're flipping exhausted and they're
Yeah.
cold, or like loitering, like falling asleep, trying to get warm in a place. So our EPD is going around giving these people tickets for this stuff. So
Yep.
what the court system does then is move them into the community court. And the city was super excited about this program that we're doing. And so I have almost full approval now from those folks at community court to provide the Whitaker Community Council with a place at the table in terms of their resource room.
Right.
So what that means is that if somebody is going through the machinations and frustrations of community court, we will be there on the other side in this resource provider room, and we'll be sitting along folks with like Whitebird, who's there, Fuse, El Centro, like there's all these different partners that are doing exactly great work like we're trying to do here.
Right.
And they'll be there. Yeah. And so from there, if that's where I figure we'll do intake about if somebody's, getting tickets because they keep parking their camper in somebody's driveway, we can say, hey, let's work directly to get you into a proper unit, and so that's,
Yeah.
it's going to be a little touch and go. And I'm not certain like exactly how much we can really do in that space, but I think it's an important place at the table because, the city, from folks that I've talked to, are just thrilled with this plan. And so I think there's a lot of motion about like, here, try this, call this person. And so we've just been doing that constantly. The second part of that now is I meet with the rental cooperation, or I'm sorry, rental coordination person, rental navigation coordinator, sorry, for the city. Yeah, I meet with her, I think Friday. And so that's going to be, that to me is the big one, because that'll be another like tap flown on coming towards us of people in need. The other one that is interesting is to be part of the 211 system. So I went through that whole chain today and I did the whole sign up for it. So what that means is when somebody in crisis calls 211, there's subsections that you can ask for: COVID help, rental help, blah, blah, blah. So Whitaker, this program will be a subset of that housing thing. So you can dial 3 and then someone from the city will get on and they'll say, okay, they'll listen to the problem. And if we have any of the resources that they need, then they take the intake form and they send it to them, or I get a phone number. And so we can follow up there too. So
Wow.
that's like 4 major things with the
That's huge,
Yeah.
Doriandra.
Oh, thank you.
Pretty
Yeah,
nice.
That is
pretty
huge.
exciting. Yeah.
The other question I had related to the list of the partner organizations, and I'm relieved to see that I think it's called the Springfield Eugene Tenant Association. I think SETA, I think, is their acronym.
Yep.
Eugene Springfield Tenant Association. The other one is, have you had any contact with the unhoused group within the Human Rights Commission? The Human Rights Commission now has a subcommittee specifically on that issue. Have you had any contact there?
That's kind of aspect 4 in terms of the city. So the health and human services, that will be an additional partnership that's pending. I'll probably get more information for that next week.
Okay.
But that'll be so neat because that's the Lane County Housing wait list. So there's 3 individuals on that side that we're gonna connect as well. So
great. Okay.
Yep.
Thanks for answering my question at such length. I'll let you get back to your storyline.
Okay, I'm almost done. I know this is a lot, but then I wanted to also, hi Jen. I wanted to also touch on the agreement and plan moving forward with the Eugene mission. So those folks are so interesting in that, when Cheryl and I kind of sat down and think tanked how we could do this, Whitaker Community Council now will be in place to support their life change graduates. And that's that neat program where that's so cool. They learn how to make charcuterie trays and how to, do bow and arrows and just kind of like learn the joy of, just adapting back into lovely life. And so what they tend to do is when people graduate through that program and they're ready to really re-enter the world and get real housing for themselves or family, there's kind of like quiet donors apparently on the back end there that support that. And so essentially we'll be in that place now too. So the mission can call me and say, hey, we've got this family and they've made this thing and they found this place they want to go. And so we will be in place then to handle that really neat aspect where we're helping people get into an actual rental rather than helping them stay in the one they have. So yeah, I think it's just kind of been like throwing darts in all directions to see where we could kind of line everybody up. And yeah, it's going really well. It's just it's a lot. And I think that's all.
Well, there is so little housing out there. The fact that you're able to come across all these different methods, even if no single one's going to be grand,
Mhm.
you may simply need to do that kind of scattershot in order to be able to find what there is to find. So
Yes.
thank you. That was excellent.
Excellent. Thank you. Yeah, I really appreciate that. I know that's kind of like my biggest fear with this is that like without all those channels open, we just
Right.
wouldn't be able to really help anybody. And so
Right.
the last part of this puzzle is that I've been talking with Sarah Grace, who was the social media manager for us for a while. And I'm asking her to get back on board. And if she can, then that's where that part of my budget will go. And then we'll work together to create a couple new graphics for the Housing as Healthcare plan.
Nice.
And then I want to use some of that budget to put it in Eugene Weekly, just once. God, those
Sure.
ads are so much money. They're like $600.
Oh, wow.
And then, do a big one there. And then we would just get our WCC pages on social media active again with the program details. And then I know we'll get so much that way. I hope, I hope that, but yeah, now we've got all the kind of like legal papers ready from the ORAP department, the ones that I shared with you. So we're
Mhm.
ready to receive. So Delenia,
Yeah.
what you think?
One thing that we might want to consider too is when you guys are starting that social media is not just doing like, do you need help, but also maybe putting out the word of, do you have a rental that's empty?
Yeah.
Yes.
Both
You
ways.
know,
Right.
kind of like a two-way,
Love it.
give us a call.
Sure.
That's excellent. Yeah, because to bind those two aspects, that's brilliant. Yep. Okay.
The tiny pantry method of housing.
Yes.
Take what you need, leave what you can.
Mm-hmm. Definitely. Okay. Yeah, I hope that once the word starts moving around, that folks in the Whitaker community would be like, hey, that's a great idea. I'm gonna give up my Airbnb and do this. So but yeah, I'm kind of stalled because if Sarah Grace can't do it. I mean, do we have anybody that's good at building graphics? I I wouldn't know my way around
Maybe
Photoshop.
perhaps she could, if she can't, perhaps she could suggest somebody else who could.
Yeah, I'll do that for sure. I mean, I thought about asking Claire.
Sure.
She might do neat stuff with her job but I don't know. Okay. So that's my update.
Yay. That was a hell of an update. Thank you.
Good.
Good job.
Thank you.
Okay. I do want to at some point bring up the Cleaner Air Oregon thing. Before we get into that, are there any other subjects that we want? We do have a whole half an hour. Oh my God, what are we going to do at the time? Yeah, Delinia.
Just kind of wrapping into that.
Sure.
I did reach out to Travis, and I think you were on that email.
Mhm.
I asked Travis if he knows of any, because, I kind of took into consideration what Brad was talking about and them
Right.
and our businesses. So I had asked Travis, is there any, grant funding out there for businesses
Ah,
to be able to update their air quality filters and things like that? He did write back and says he doesn't know of any of those opportunities, but they might be out there. But that might be one way of, if
sure.
somehow in the future you know, the Whitaker Community Council can help the businesses here get those grants so they can update their stuff.
I have an idea on that, which is, so we need to have places where people can go to have clean air when the air is poor and they don't have a place of their own to go it. So what if, and if we could find the money for it, what if we helped businesses get clean air filters in exchange on days when the air was really bad? They would help a limited number of people stay out of the bad air in exchange for getting a clean air filter. I don't know. It's just a thought.
Yeah, let's run that by a couple of places. Say, hey,
Yeah.
would you be willing to do that? Not
Yeah.
that you have to. We're
No,
just,
we're
we're throwing,
thinking about it. We're trying to
yeah,
figure
we're
out a way
just throwing things on the wall.
how can we make this work for everybody, you know?
Yeah.
It's just a thing. But I like the idea because definitely, I mean, honestly, yeah, that kind of smoke, that's our future.
Yeah.
It's sad, but it's true. We got a lot of forests. Hopefully some of them will remain, but a lot of them are going to burn. And that's just how it is.
And that 2.5 micron stuff doesn't necessarily show up immediately. That can manifest much later in life.
That's right.
And the like N95 masks at this point are needed for these conditions.
The other thing we should do along those lines is we might want to occasionally put on workshops on how to put those on properly. Because honestly, if you don't put them on right, they don't really do you much good. Over at Public Health, every year we do fit testing to make sure that we have them properly fit to our faces. There's this stuff that you spray, and if you can smell it, it's not working. So something we might want to think about along those. I will think about that. I will put that. I'm the public health guy. I will. I will. Since I'm mentioning that, I will have that lodged in my brain. Something that we need to do at some point. Thank you. I think that's great. Okay, so I'm going to share in the chat the website for the Cleaner Air Oregon website. There it is. So the reason that this is important and why it is different from previously, you may have remembered the conversation we had with Travis at the last meeting, is heretofore direct impact on health was not part of the calculation on air quality. They had some nebulous idea, and you should have so many particles per million of the 2.5, but there was not really a thing saying, if you do this, this is going to happen, right? Now they do. And that makes a big difference as to how you do things. And the thing is, we can demand information about that. One of the things I think that would be really helpful is if, when they're asking for exceptions, it ends up being laid out in terms of how this is going to impact people's health, and we get that out to the public. Not just, okay, there's some numbers, this number is going to change, they're going to go up by 30%. Is that okay? No, there's going to be this many cases of emphysema. There's going to be this many cancers. There's going to be this many forms of lung disease and heart disease based on the fact that they're going to be increasing these numbers. They now can do that and will do that if we insist that they do. So I think, for one thing, it just makes more sense to the public. They will understand the implications better than they would just a bunch of numbers, if they understand how this is going to impact health. So give me just a second here while I pull that up. So you'll notice if you go to that page, they have background and rulemaking, stuff for the community, stuff for facilities, regulating by health risk. How do agencies determine what a health risk is, blah, 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 and how to contact them. They do actually have a cleaner air at deq.oregon.gov. So this is not LRAPA. This is, in fact, the state of Oregon. Although Travis did say that LRAPA is the agency locally that enforces that. So we would probably have to go through them first. But we might be able to get information directly from the state too. I'm not sure, but it's something I'm going to pursue. And if anybody wants to help me with that, I wouldn't mind. Stephen, if you're interested, we've worked together before.
Yeah, possibly peripherally. There's a lot of other stuff going on right now.
Absolutely. I understand. I'm not asking for much.
Yeah.
Brainstorming as much as anything else. But it's a thing that it's a change that's needed to come for a long time. And since it's here, I think we really need to use that. Anybody have any thoughts along those lines?
Yeah. Would you consider El Rapa a captive agency? Would you consider they're being captured by industry, or you think they're still working in the public interest?
I can't really say for sure, but I would say that at least the original intention was that it would be more locally controlled. Has it been captured by industry since they set it up like that? I don't know. Maybe. Perhaps it's kind of half and half. I can't say.
It feels like one. I mean, from my experience in interacting with agencies,
Right.
definitely the interacting with it from outside, it certainly gives that suggestion. But
I wouldn't be at all surprised.
Yeah.
I think El Rapa there were a whole lot of things that happened around that same time, having to do with wanting to have more local control over stuff.
Yeah.
El Rapa, when it started, was part of that movement for more local control.
Yeah.
But just because that's how it started doesn't mean that's how it is, right?
We probably have to look at people's job performance, see who is there a revolving door between El Rapa and industry jobs. That's usually an indication.
That's definitely a thing. If that's going on, that's definitely an indication of what you were saying, for sure.
Yeah, we'll keep an eye on it.
That's a primary thing. Okay. I don't really have a whole lot more. I'm tired. It's been a long day. And I think we've had some really good discussions. Does anybody want to bring up anything else? Jennifer, you always have things going on in the back of your mind. I can see it. Anything else you want to mention?
You're on mute. You're muted, Jen.
Oh.
Embarrassing. Did you read the NORP?
Oh, the NORP. I have not read the NORP yet. I am going to read the NORP. I will absolutely read the NORP, if for no other reason than being able to say, I have read the NORP. But
it is not fun. It's boring, and it makes you scratch your head. But that's why we exist. It has a lot to do with why we exist.
Absolutely. I found that before, and I put it on the chat back in general thing. But I got to tell you, so here's the thing: when we record these things, the chat never gets recorded, right?
Right.
I couldn't even go back and find the stuff that I posted, which was really embarrassing. Okay, so please, because I can't find it, could you please tell me again what the acronym stands for?
Yes, Neighborhood Organization Recognition Policy.
Right.
And it's now run by OC, which used to be formerly HRNI. It's Office of Equity, Community and Engagement. It's starting to roll off my tongue more. Anyway, so the thing is that I sent an email to everybody, except for, I'm sorry, I didn't send it to you, Doriandra or Stephen. I will if you want me to. But yeah, everybody should read it. In my opinion, if you are going to be a board member, you should know the charter. You should know the NORP. But he is brutally.
It makes it so much easier that it's funny. But, I mean, keeping a sense of humor is one of humanity's saving graces, right?
Yes.
So,
Yes.
if you can try to keep a smile on your face when you're doing it, it makes it a lot easier.
You're
Delineate.
sweet. Arnaud, you're always sweet. That's all I can tell you.
Well, I try. I'll tell you, it takes a lot of energy. Delineate, you're raising your hand there for a second there.
Yeah, mine's kind of like on the next thing. So
Cool.
As far as like all the information that Doriander has presented, I'm trying to keep our contractors who are in this specific group just in public health and safety.
Okay.
But I was really hoping that maybe at the December meeting, one of us from here,
Mhm.
Anand, can do a presentation for the general public of what's been happening with the housing.
Okay.
You think that would be?
Doriandra, if you can help me with it, I can do it.
Okay.
I can read things in public. I can do that.
Yes, you
Okay.
can.
I'll just give you a script and not.
Give me a script, I'll read it. You
Okay.
don't have to read it. I'll read it.
Okay.
Hopefully you'll be there in case people have questions.
Yeah, I don't
Cool.
mind presenting if that's easier for you, Anand.
That's
So
okay too.
yeah, if that's okay. Yeah,
Whatever makes Delinia happy. She's running, she
she's
runs
the boss.
everything.
She tells us.
I'm just back here. And that's fine. I was the boss for a while. I don't want to do that anymore. I'm happy being here. You get to do that. That's fun. You have
You
fun.
should have warned me, Anand. You should have warned
Sorry.
me.
I'm just cruel like that. What can I tell you?
Yeah.
But he has a smile on his face, so that's okay.
Yeah. And then just to let you guys know, next year I'm definitely not going to be on the board, but
Saw
that
that.
does not mean I won't be with committees. You know, Stephen and
Oh,
I
that's
are
nice.
talking about
Cool.
doing like our own little subcommittee.
Oh, nice.
Yeah.
Good for you guys.
Yeah.
That's
But
right.
I'll still be here to help.
I think the point of having an organization like this is you're supposed to have different people taking different positions so that people get more experience and more of the communities involved. You want to do that? That's great. Thanks for continuing to be involved in the capacity that you feel that you can. That's great. And in no fashion should anybody be criticizing you. And if they do, I'll be happy to kick their butt for them.
Thank you.
Welcome.
I will be happy to hold them while Anand kicks their butt.
Thank you. Stephen, you're so helpful.
Go get him, Anand. Go get him.
I haven't done that shit for years, but every once in a while.
You could pull a muscle in the process.
Oh, God, yeah. My
Pull
tendons
your
are all
back out.
fucked. I would, but my back's out. Yeah, that's right.
Why don't we let Anand get some soup or something before the board meeting?
Yeah, I better take off. You're right. Thank
Okay.
you, Stephen. That's a good point. I need to get some dinner. All right, I'll see you guys later.
Bye, Arnaud.
Bye
See
bye.
you all. Okay. Bye.
Wow,